Started a very simple and a small remedy by name ALLIUM CEPA. Okay. So any quick questions in ALLIUM CEPA, whatever we have done. And before we continue, we'll have a quick recap of what was done. And if at all any area you're finding it difficult, we'll take up that particular area again and then we'll go further. Okay. So I did very minimal, if you remember in the last class. And I also told you, please go through two small books. Okay. One book I told was Allen's Keynote, especially when you are looking at the characteristic symptoms, beautifully mentioned in Allen's Keynote. And as a homeopathic student, I was trying to tell you yesterday, all the remedies should be on your tongue tip. It's a beautiful materia medica, very handy. And one more materia medica I told you is Kent's, which though is a little elaborate, it is very important. Fine? You'll get a picture of ALLIUM CEPA. Okay. So I'll quickly revise what was done and then we'll go ahead. If you remember, two small components we had taken. One was introduction as a larger thing, and then we looked at characteristic symptoms. Okay. Under introduction, I told you lot many things. We spoke of the pharmacy part, wherein I told you about the drug, the family, the common name, the part we use in homeopathic materia medica, okay, the preparation, habitat, etc., etc. We also saw a great man, Dr. Constantine Herring, who proved a simple remedy, ALLIUM CEPA. Okay. And then we spoke of a very important part, and that part was sphere of action. If you have to understand materia medica better, you need to understand sphere of action, which is very important. And we also spoke of sphere of action and an extended part of sphere of action, what we termed it as pathogenesis. Hope it's clear. So quickly, where exactly you see ALLIUM CEPA acting? It mainly acts on mucous membrane. Eyes, nose, throat. Beautiful. And what exactly it causes? Increased secretions. It is causing excess secretion on the mucous membrane. Okay. Second area was nerves, and we also had veins. On nerves it caused neuralgia, and veins it caused phlebitis. And the last area we spoke was causation, under introduction. And ailments were plenty. If you recall, we spoke of first thing was damp weather, exposure to cold wind. We also had ailments after eating peach. And I told you the only remedy is ALLIUM CEPA. Good. And we also spoke of getting feet wet, operations, eating salad, okay, a forceps delivery, fine. See, cough is a characteristic symptom. Done? Okay, cough is a characteristic symptom. Okay, injuries. Injuries mainly to nerves. Ailments after amputation. So these were few things we spoke. One more? Shoe bite. Good, shoe bite. These were the ailments. See, ALLIUM CEPA is the first remedy we are talking. For you, you need to understand the importance of the heading. What exactly ailments mean and what is the importance of ailments, you need to understand. Okay? And you will see when somebody talks of another remedy, for example, morning madam has spoken to you about Ethusa. I see on the blackboard. Ethusa will have its own ailments. Ethusa nervous system, the action was entirely different. I hope slowly you start appreciating. Don't get confused. Oh, Vijaykrishna sir is doing ALLIUM CEPA and one more ma'am is doing Ethusa. But you will get the variation. I am doing ALLIUM CEPA. ALLIUM CEPA is also acting on nerves. Ethusa is also acting on nerves. Okay, it's all there on your blackboard. I have not erased it, I have kept it so that you understand. ALLIUM CEPA, it is a short acting remedy and it can cause only neuralgia. In Ethusa, you see something higher. Do you see neuralgia in Ethusa? Please understand. Do you see neuralgia in Ethusa? But Ethusa is also acting on nerves. Remember. But what is Ethusa causing acting on nerves? It is causing convulsions. Okay, it is causing convulsions. Fine. Beautiful remedy for convulsions. Then epilepsy. Okay, mainly convulsions. A very good remedy for convulsions. So this is the variation you need to understand. Tomorrow somebody else will talk of some other remedy. There also you see that remedy acting on nerves. The cause or the result might be something different. Okay, don't get confused. Sir, 50 remedies in second year. No. You should not have the concept of confusion. Every remedy, when it is taught, you should have that clarity. ALLIUM CEPA, yes. I was lucky to have students, Way back we did not have PPT. We had only blackboard. Students till date they remember, sir, on the extreme left of the blackboard, in ALLIUM CEPA you had written this symptom. See the clarity they had. Done? So there is no scope, there is no role for confusion in materia medica. Done? So try to understand the concept so that at the end of second year, though 50 remedies are done, you are all confident, you are all clear. That is what we are struggling for. Okay? So we'll get back. Characteristics is what we also spoke. What did we discuss under characteristics? We spoke, see, now why I am stressing on the ailments, why I am stressing on the sphere of action, and now why I am stressing on characteristic symptoms is the next heading that we are going to discuss. Okay? Only if you are clear with these three components, the next heading or the class that I am going to do now will be clear. Otherwise confusion will start coming up. Okay? So sphere of action you are clear, ailments from you are clear. We will quickly recall the characteristic symptoms. What were the characteristic symptoms we spoke? First thing was discharges. Acting on the mucous membrane, we saw it causes excess discharge. So what is the character of discharge? And see the variety, see the beauty in ALLIUM CEPA. It is acting on eyes, it is acting on nose. And what is the common thing you see there? It is causing profuse discharges. But what is the speciality you see there? Eye discharge is bland. Nasal discharges are accurate. This is why it is mentioned under characteristic symptom. Okay, that was one good. What else? Yeah, very good, beautiful. I am happy you have gone through left to right. Not everything in ALLIUM CEPA goes from left to right. Okay, mainly the nasal symptoms. Left nostril first, followed by the right nostril. Good. Then phantom pains, beautiful. Phantom pains, neuralgic pains, pain like thread like pains. Good. Voice. Yeah, what happens to the throat? He will be holding the larynx. Throat, not larynx, throat. Why? They feel like when they are coughing, they feel the throat or larynx will burst, split. Good. Then nasal polyp. What do they like? What do they like in eating? Onion, red onion. Good. And what is it that they are not like in eating? Cucumber. See, yesterday, luckily I had a case. Of a man with infertility. Okay, fine. Primary infertility, and he's got a lot of issues with his sperm count. There is issues with the count, there is issues with the morphology, there is issues with the motility. See the coincidence, yesterday morning we spoke of ALLIUM CEPA, evening I get a case and my assistant has taken the case, and in the case, one thing that gets highlighted in the case is, this man has a strong aversion to cucumber. Oh, see the coincidence. Now I want to bring it to your notice. Can we give him ALLIUM CEPA? Why? Did I mention anywhere when I spoke to you about sphere of action, ALLIUM CEPA acting on the male genitalia? No. Done? So just because he has aversion to cucumber, I can't take the risk of prescribing ALLIUM CEPA to a case which is a serious case, and that case is of infertility. I hope you are getting my point. Right? Done? But ALLIUM CEPA has aversion to cucumber. Must be if it was simple cold, something like that, I could have thought of ALLIUM CEPA. Or I may have to read ALLIUM CEPA once more in the source books, and we'll have to see if ALLIUM CEPA has action on the male genitalia. Unfortunately, no. Done? And it's a serious chronic illness that we are treating, and ALLIUM CEPA will not match. Similia similibus currenter. The only thing that matches in ALLIUM CEPA is cucumber. Must be if I prescribe ALLIUM CEPA to him, max to max, what can happen? He might start loving cucumber. Fine? Wife will not be happy. Sir, I did not get my husband to you so that you will start liking cucumbers. I want kids. She has come to you with a different purpose. You are getting my point. So ALLIUM CEPA is a very short acting remedy. I can't risk prescribing ALLIUM CEPA to this particular patient. Done? Done? Okay. So aversion cucumbers. Aversion cucumber is something very strong in ALLIUM CEPA. Any other characteristic symptoms? Abdominal pains, shoe bite, yeah. Tearing pains, good, agreed. So this is what you need to understand. Now our next 20 minutes class will go very smooth. There is a simple formula to understand particular symptoms. See, this is your first class, you feel great, you feel nice. As I was just trying to tell you, more remedies now. I mean, you start landing up with headache. It's a coincidence. Luckily headache came. It's not a magic. Okay. So what I was trying to tell you is, you start getting, especially particular symptoms will have a lot of issues. Because every remedy has symptoms from head to toe. And remembering 50 remedies, head to toe symptoms might become a little tricky. So if you understand, using a formula, you will remember particular symptoms better. Okay. Now what is that formula? Is like, for example, understand sphere of action, understand ailments, understand characteristic symptoms, and you start applying it from head to toe. It will become very easy for you. Okay. Now in ALLIUM CEPA, under head, what symptoms can you expect? Now before I start off with headache or head symptoms, I just want to have a small clarity. What exactly you understand by particular symptoms? And what do you mean by particular symptoms? Particular symptoms are symptoms pertaining to a part. Boys, pertaining to a part. Okay? When I say a part, it means hand, it can be head, it can be eyes, ears, nose, any of your part. Okay? Particular, see, the word itself has part, particular symptom. And particular symptom is always denoted by the word my. General symptoms are always denoted by the word, it's all told in first year. General symptoms are always denoted by the word I. I feel hungry. I feel thirsty. I get irritated. General symptoms are of two types, mental generals, physical generals. I am jealous. I am getting suicidal thoughts. I feel depressed. I am elated. I am happy. I am cheerful. So you use the word I, which is denoting the entire you as a whole. Fine? When you feel thirsty, what do you tell? Do you tell, sir, my mouth is thirsty? Do you tell, sir, my stomach is hungry? Do you tell that? Though it is this here, but what is the word you use? I. Sir, I feel thirsty. I feel hungry. I feel sleepy. I dreamt. You are using the word I. But when it is particular, what you tell is, sir, my head is paining. I head is paining? No, wrong English. My eye is pricking. So use the word my. My denotes a particular part. I denotes the entire you. Okay? So we are looking at the particular symptoms, meaning symptoms which are pertaining to a particular part. My knee hurts. My back pains. Fine? Okay? My nose leaks. You can't use the word I here. It looks very funny. Not make sense. Fine? I back hurts. No. However poor you are in English, you can't use all this. Fine? So particular symptoms are symptoms related to a particular part. Done? Done? So we look at those areas where ALLIUM CEPA can act, okay, from head to toe. It's a short acting remedy, so don't expect ALLIUM CEPA acting from head to toe, all parts. But there are few specific areas where ALLIUM CEPA can act. And when I say specific area, what is it that you will be going back to? What is it that you are going back to? Sphere of action. Sphere of action. Okay. So first part you see is it affects the head. Affecting head, what can ALLIUM CEPA cause? Huh? Okay, there can be simple headaches. Why headaches? Why headaches? In ALLIUM CEPA, the ailments, you know, they get exposed to damp weather, they get exposed to cold wind, and it's a very good remedy for cold. So probably, you know, exposure to cold can bring in headaches. Okay, headaches. Fine. Headache mainly in the forehead. What is the next thing I am trying to tell you? What is this I am trying to tell you? Location. Location, location. Keep it simple. Don't complicate. The headache, going back to your anatomy, you have different parts of head. You know, frontal, occipital, parietal, we're not going to vertex, etc., etc. In ALLIUM CEPA, headache is mainly forehead. From forehead, the pain can extend to the eye or to the face. Simple. What is it? What is it? In ALLIUM CEPA, you have headaches mainly in the forehead. Boys, mainly in the forehead. Headache extends to eyes or headache extends to face. Right? Headache better. Headache better. Meaning, you have headache. So what causes headache? Where is the headache? And when is it more? When is it less? Is what we ask. Now what is this called? What is this called? Location, sensation, modality, concomitant. Location, sensation, modality, concomitant. It is called a complete symptom. Complete symptom. I told you yesterday, kindly go through your first year syllabus. For first years there is no material exams, so you have taken material for granted. So please go through your first year syllabus so that you know the second year classes becomes interesting. So what is a complete symptom? A symptom which has location, sensation, modality and concomitant. Okay. Dr. Boning Hassan, he introduces this location, sensation, modality, concomitant. Artha agta idea? So this is complete symptom. So we'll get back here. I was talking to you about the location. Where is the location? Forehead. Is it limiting to forehead? No. What is happening? It is either going to the eye or it is going to the face. The first part. Second part, we are also trying to understand the modalities. What do you understand by modalities? Modalities matlab kya? When it is more, when it is less. Modalities will include two things. Modalities will include two things. Good. Aggravation. Aggravation means increase. Amelioration means decrease. So in ALLIUM CEPA, headache aggravates warm room. When they are in a warm room, the headache increases. Okay. When they go out in open air, they feel better. So they feel better means it is amelioration. See, one more very important thing that ameliorates headache in ALLIUM CEPA, and that is discharges. See, don't be very particular about making a note. I'll give you a printed note. Fine? Please focus on the class. And for a teacher, eye contact is very important. If you are busy writing, I'll feel disappointed. I'll feel left alone. Whom am I teaching? Right? So always your eyes, at least a teacher's eyes should be, we need to look at all of you. And all of your eyes should be on me. Then, that contact is very, very important for a good class. Otherwise, we will lose that connect. We will not be connected. Done? So let's stay connected. Please close your books. I saw yesterday, I was very happy, many of you are making notes. But if all the classes is this continues, then things might become a little difficult. Okay? So we'll get back. I'll give you a printed note. Done? Or in spite of me telling all this, if you're comfortable making a note of key points, you can always do that. But please try to maintain the contact, very important. We'll get back. What I was trying to tell you is, headache better by discharges. Your books give you this symptom, headache better by discharges. So what do you understand by this statement, headache better by discharges? Meaning, when they have headache, okay, if the nose starts flowing, for example, if they have cold, with cold, the headache, they feel better. Okay. Or a lady during her menses should have observed that her headaches during the menstrual flow, she is better. Okay. Headache amelioration flow. Headache amelioration flow. Any confusion here? So head, you will be remembering only one part or one point. What is that point? Headache. Location, we had a modality, and the important modality what you saw was ameliorating factor. What ameliorates? Flow. Discharges, nasal, menstrual, fine, or leukorrhea, white discharge, any kind of a discharge, they feel better. ALLIUM CEPA. Done? All of you are clear? We'll go ahead. Okay. Now, the next thing you can start, this is only a small image. Now you can start contributing. You can start telling. See how easy Materia Medica is. Now think, on eye, what is ALLIUM CEPA doing? You all know that. On eyes, it is causing inflammation. Okay. It is increasing the lacrimation. Okay. What is the one last word you are trying to add here? What is the last word? Very good. Loud. The lacrimation. What is the character? Yeah, bland is very important. There is lacrimation, and the lacrimation is bland. That's it. Full stop. Eyes. So eyes, it is causing profuse lacrimation, and the lacrimation is bland. समझ में आया? चलो आगे बढ़े. Okay. Now one small information related to ears. Okay. It causes pain in ears. If you have read Kent's yesterday, Dr. Kent mentions it causes pain in little children, and the children with ear pain, they keep crying, they keep yelling. ALLIUM CEPA. Okay? Okay? Fine? So 3 things we spoke, very small topics. One was head, then next we saw was eyes, and the last thing I just spoke was ears. Now comes the very important thing. What is the important thing? And how am I going? How am I going? I am following an order. What is that order? Anatomical order. When we started with head, we spoke of eyes, we spoke of ears, now we are talking of nose. Simple. See, if you understand Materia Medica like this, just close your eyes, the image, the picture should come. And trust me, if you study like this, confusion will not be in your dictionary. Done? But you will have to understand. So what is the next area? And nose. What is the importance in ALLIUM CEPA? Nose is the prime area. In ALLIUM CEPA, nose is the main area or prime area. Okay. Now you can start contributing. What can happen related to nose? We will follow very good, I appreciate. I am sorry to interrupt. We will follow an order, because nose complaints are asked in your exams for 5 marks, and I want you to get full marks. Done? And please follow an order. Now what is the first thing that comes up there is causation. One second, don't jump. Don't tell me, sir, forceps delivery. Why forceps delivery should not be used under nose? Why? Why? Very good. Beautiful, good. In ALLIUM CEPA, forceps delivery will lead to phlebitis. So in nose there is no role. So when I say causation, don't read all the causation. Confusing? What causation I told you in the last class, there are general causative factors. And what causation we are discussing now is what? Beautiful. Particular causative factor. Among the lot I gave you yesterday, you are picking up only what is relevant to nose. Hope I am clear. So now what is relevant to nose? Now you can start answering. Cold air, very good, beautiful. Cold air. Damp air. Damp or wet weather, cold air. When a person gets exposed, he can have nasal complaints. Fine. So one, we are having a causative factor. Now, what happens when they get exposed to cold? Okay, now before discharges, you can also see that there will be sneezing. There will be bad sneezing, bad irritation in the nose, and then they start sneezing. Continuous sneezing, violent sneezing, irritation in the nose, and they start sneezing. And after sneezing, what you also see is there is coryza. So there can be sneezing or there can be coryza which can be independent. Not necessary that they have to start with sneezing. If somebody comes, sir, I got cold, don't tell them go back, sneeze and come back. Only then I'll prescribe ALLIUM CEPA. No. ALLIUM CEPA can have coryza. ALLIUM CEPA can have sneezing. So what you also have to understand here is, acting on nose, you write the causative factor. The second thing you write here is sphere of action. Acting on the nasal mucous membrane, what will ALLIUM CEPA do? It increases secretion. Good. You can use the word inflammation if you want, or you can use the word it increases the nasal secretions. That will be the second point, systematic point. Then you start contributing. Now start telling me what can happen under nose. I contributed something. What did I tell you? What did I tell you before that? Cheek, sneezing. And what is the character of sneezing? Continuous, constant, continuous. The moment they enter a warm room, okay? The moment they enter the warm room, they start sneezing. Akshi, sneezing. Okay, one. Then, and they are also very sensitive to smell of flowers. Okay, for example, if you have a girlfriend, okay, and for example, if you offer a rose, or if you are offering her some flowers, okay, and in case if she is sensitive to flowers, many of them are sensitive to flowers, you see them sneezing. Okay, so ALLIUM CEPA is one such constitution who are very, very sensitive to flowers. Odor of flowers, they can't bear. They start sneezing. They start getting cold. Okay, so two headings we spoke: ailments, we spoke sphere of action. Now we are discussing what symptoms ALLIUM CEPA can produce. You are all with me? All clear? Good. So we'll go ahead, and this is what you saw. What is it? She is sneezing, and then you also know there is a nasal polyp. Which side of the nose you have nasal polyp? ALLIUM CEPA is a left-sided remedy. Mainly you have nasal polyp on the left nostril. Don't tell left nose. Nose has two nostrils. Fine? You tell left nostril. If you tell right nose, it is not yours. You are talking to the person who is on your right hand side. Okay, chalo. So nasal polyp, sneezing again, you know, the moment, what did I tell you, when do they start sneezing? The moment they enter warm room, there is sneezing. Okay? And sneezing from smell of flowers. They are sensitive to odor of flowers. See, you will be learning a lot of remedies. Even in your organon, there is a topic that will be told, idiosyncrasy. People are very, very sensitive. For example, some movies you would have watched, they smell flower and next minute they faint. Fine? So what you also have to understand is, tomorrow somebody comes and tells, sir, you know, this guy or this girl, when they smell flowers, they faint. Can you think of ALLIUM CEPA? Yes or no? No. Why no? Allium cepa will not cause fainting. Allium cepa will cause sneezing. You getting my point? So don't understand homeopathy in a wrong way. And don't blame homeopathy. Sir, he fainted. I gave him allium cepa. Nothing happened. Nothing will happen. Take it from me. Because allium cepa is not the remedy which causes fainting. Allium cepa is a remedy which causes sneezing. अगर आपको चीख आ रहा है ना, चलो दे दो. Fine? You're getting my point? So this is what I want you to understand. Because somebody tomorrow will talk of a remedy in which they smell flower and next minute they faint. If you want him to faint, give him flowers. Chal, thap, he'll faint. It's a different remedy. And then you give a remedy, then he'll get up. Fine, it's a different remedy. So sneezing which comes from odor, sneezing on waking up, okay, these are few things. Profuse, constant, now we'll come to coryza. Very important. Cold, coryza. Watering in the nose. Now tell me the discharges of allium cepa. Where did I tell you the discharges? Under which heading? Under characteristic. That's what I am trying to tell you. If you would have understood sphere of action, ailments, characteristic, particulars is very, very easy. They are all interdependent. Then now you can start writing. Now what you start writing here? There is discharge, and what is the character of discharge? Acrid, beautiful, profuse. Okay. Now start understanding. If it is acrid, what will happen? Very good, absolutely right. I feel nice when I hear some boy's voice. Okay, good. Somebody was telling burning. Yeah, it excoriates. It is acrid. It excoriates means it is eating of the flesh. Skin on the upper lip. See, the discharges in allium cepa is so acrid, it will eat off the mush. Girls, it's not for you. What I am trying to tell you is the discharges are so acrid that the hair is eaten off. तो लड़कियों में जिनके पास मूंछ नहीं है उनमें क्या होगा? The upper lip will all be corroded. The upper lip will be red, and the skin, everything would have come out. So acrid or so excoriating is the nasal discharge in allium cepa. See, this is all what we are building using your common sense. There is discharge. Discharge is acrid. Acrid means burning. Acrid means excoriating. Excoriating means eating of the mush, or the upper lip will become red and irritated. Done? And where is the discharge starting from? It is starting on the left nostril, and then it is going to the right nostril. Excoriating discharges from the left nostril. Only remedy is allium cepa. What is it? Excoriating discharges from left nostril. If it is only from left nostril and it is very acrid, जल रहा है डॉक्टर साहब, कुछ करो आप, जलन हो रहा है, fine. The only remedy is allium cepa. You getting my point? That? Okay. See, discharges acrid, profuse, and naturally it is irritating. When it is acrid, it irritates. So you see the child, doing this, he feels better. He keeps rubbing his nose because of the irritation. And one of our boys, he told, the discharge which burns, jalan. And what I also wanted to try to tell you is, this area can get corroded. Acrid nasal discharge, especially from the left nostril. We just spoke that. And again I was trying to tell you about this part. So acrid that it can eat off the mush, eat off the hair, mush. Okay. See, as a second year student, in brackets, please write one more remedy, and that is arsenicum iodatum, which again has acrid discharges excoriating discharges which are capable of causing destruction of the hair is arsenicum iodatum. Somebody will talk in future. I am not start with comparison. I want you to understand one or two remedies. Then we can start comparing. Okay. So we'll go ahead. Yeah. Sensitive to smell of flowers, or smell of flowers can also bring in coryza, bring in sneezing. Okay. And modalities. When is it more? By now many things in ALLIUM CEPA, they get aggravated on entering a warm room. So entering warm room aggravates aggravation. Evening, good, beautiful. Evening. Go with the picture. Keep it simple. Aggravation, evening. Amelioration, open air. Okay. When they go in Kula Hawa, open air, they feel better. ALLIUM CEPA. Okay. So nasal complaints of ALLIUM CEPA, you start with what? First heading. What should be the first heading? Causation. Second heading will be spear of action. Third heading will be the symptoms. Nose, what ALLIUM CEPA is capable of producing. Okay. Coryza, sneezing, polyp. Okay. And please explain all these things in detail. Symptom starts from left, goes to right. What is the character of sneezing? What is the character of coryza? All those things you explain in detail. We spoke of modalities, and one last heading here will be associated complaints. With nasal complaints, what else you have in ALLIUM CEPA? Associated. So what is the associated complaints here? What is the associated complaint? Acrid nasal discharge associated with bland lacrimation. Only remedy in our Materia Medica. When I say only, you understand the weightage ALLIUM CEPA carries. Done? So I'll repeat this. Nasal complaints associated with bland profuse lacrimation. Nasal complaints associated with headache. Nasal complaints associated with cough. These three things you can mention. Concomitants. Headache, bland lacrimation, and there can be cough associated with coryza. Okay. Any quick questions? We'll go slow. I have another 10 minutes. Headache, all clear? Eye complaints? What happens on ear? Ear pain. And what is the child doing? Child is crying. See, you got better remedies. As a second year student, must be once they start more remedies. Now that they have started Ethusa, some teacher might talk to you about chamomilla. Is it done? No. Somebody will talk to you about chamomilla. Chamomilla will also have ear pain, or chamomilla will also have some pains. But the beauty or the difference between ALLIUM CEPA and chamomilla is, chamomilla will cry, will yell, will shriek, and the only feeling you get, is you feel like plugging her mouth. Fine. You get irritated. It is not your baby. Fine. You have nothing to do with that baby. Fine. But that's what you feel. You get irritated. So that is chamomilla. In ALLIUM CEPA, it is not that intensified. चलो दर्द रहे तो बच्चे रोएंगे, रो रहे हो बस, but not to the extent that the mother is getting irritated, the parents are getting irritated, the bystanders, they get irritated, they keep crying, shouting. That is chamomilla. We had one girl with dysmenorrhea, okay, and every month when she gets menses, the entire street will get to know that she's got menses. At least, it may be an exaggeration, at least 4-5 houses will get to know she's got menses. Because with pain, with dysmenorrhea, she starts shouting, she starts crying, and mother comes to me telling, embarrassed, sir, please do something. 5 people or 5 neighbors, they get to know that my daughter has got her menses today, because That's the kind of sense. See, they're not doing it purposely. You please respect your patients. They're not doing it purposely. Chamomilla, again, see, acting on nerves. I'm sorry to deviate. I don't know if you will appreciate this kind of deviations. Should I deviate? No. Deviation will lead more to confusion. Should I deviate? Then in the end of the class, which remedy did BK sir speak? In ALLIUM CEPA, 4 houses. The girl will start shouting. I don't want you to conclude that way. But what I also want you to understand is, must be after 4-5 remedies, we can talk comparison. You will enjoy comparison. But what I also want you to understand is, see, acting on nerves, chamomilla will cause sensitiveness. Chamomilla, I mean, it is important in this class right now because Yethusa Yusa, ALLIUM CEPA Yusa, I am talking of chamomilla now. Chamomilla is very, very sensitive. Meaning, the nerves in chamomilla, they are hypersensitive to pain. It may be a small pain. Mother would have had worse dysmenorrhea. Fine, she is calm, she is composed. But chamomilla, small pains, she starts, becoming hyper. She is not hyper, her nerves are hyper. And that is how she starts reacting. And this is homeopathy. Each patient in pain, how they react is very, very important. If it is pulsatilla, if it is chamomilla, if it is nux vomica, if it is hepar, coffea, they have different ways of expressing the pain. And that's why homeopathy becomes interesting. For a normal doctor, pain is pain. Then, आप पेन में चिल्लाओ, आप पेन में रो, आप कुछ भी करो पेन में, उनके पास सिर्फ पेन किलर होगा. But for us, homeopaths is very challenging, interesting. आप कैसे react करते हो? What is it that happens to you when you have pain? How do you react? Where is the pain? What is the character of pain? What are we trying to do? We are trying to individualize. You getting my point? Dysmenorrhea is a common phenomena. Pain is a common phenomena. But in pain, how each girl reacts. There are so many girls here. With due respect, do you think all of your reactions will be the same? No. There are so many who will not even, parents will not know, boyfriends will not know that she had her menses, she had dysmenorrhea. So nicely she will manage, she will go off. 5 houses get to know that she's got menses, is a different girl. Fine, she is chamomilla, she is a different girl. So that's what you need to identify and you need to understand. Individualization. All of us are not same. We'll get back to ALLIUM CEPA. So chamomilla acting on nerves, it will cause sensitivity. ALLIUM CEPA acting on nerves, it will cause neuralgia. That's very important. That's the take home message. Now I'll go first. Cough, you already know. What is the speciality of cough in ALLIUM CEPA? They will have some kind of irritation in the larynx. They will have cough. What is the character of cough? What is the character of cough? Dry cough. How dry it is, how difficult it is. That, it's very painful, very difficult. They feel, what is it that they are feeling? They feel the larynx is being torn. And I told you it's a subjective symptom. And when they have this feeling, what is the lady immediately doing? She is holding her throat. Simple. This is cough of ALLIUM CEPA. We have already studied this under characteristic symptoms. Any questions? We'll go ahead. Okay. So next what you have is abdomen. Abdomen you already know. Do you see nausea, vomiting and all in ALLIUM CEPA? No. What do you see in ALLIUM CEPA? You see colic. Good, beautiful. Pain. You see pain. What is causing pain in ALLIUM CEPA? Oh, very good. Getting feet wet. Beautiful. One more. Eating salad. Boys, you need to be proactive. Class was done yesterday. Eating salad, getting feet wet is what causes pain abdomen in ALLIUM CEPA. Pain typically starts in the right hypochondriac region. What do you have here? What is that organ? Liver. Pain starts in the right hypochondriac region. It goes around your umbilicus. Okay. So location, we spoke of causation. Okay. And we are looking at the location. Location is somewhere here. and it will come till the umbilicus. Aggravation sitting, amelioration walking. Pain abdomen in ALLIUM CEPA, where it starts, where it goes, what causes pain, and when is the pain more? When is the pain more? Sitting. And when is the pain better? Walking. This is the colic of ALLIUM CEPA. Cucumber, salad, they all cause pain. The last heading, extremities. What do you see under extremities? You can start contributing. Go back to your anatomy, understand what structures you have in the extremities, and then start answering. You know all this. Huh? Very good. There can be phlebitis. Phlebitis after forceps delivery. Good, beautiful. Second point. Good. Neuralgia. Where you have thread-like pains, neuralgia, and bad effects of amputation. Somebody was using the word phantom pains. So all these things can come under extremities. So you have one thing you missed. What is it that you missed? Good, very good, beautiful. Shoe bite. Okay. Shoe bite, phantom pains. Okay. Pain in the amputated stump. Fine. Neuralgia, thread-like pains is all what you have in ALLIUM CEPA. So particulars we discussed what? We discussed head, we discussed eyes, we discussed ears, we discussed nose, we discussed abdomen, we discussed extremities, we also discussed cough, good, lungs. Not lungs, again it is not that deep acting remedy. See, it mainly affects the larynx. Okay, it is not a remedy for bronchitis, pneumonia. This is what I want you to understand. Then it's mainly for laryngitis. Okay? Then where you have cough, bad cough, you know the character of cough. The last part here is general modalities. What modalities we spoke earlier? They were pertaining to a particular part, and they are called as particular modalities. Now we are looking at the general modalities. What aggravates? Getting into a warm room. Beautiful, good. And what also aggravates here is evening. Two general aggravating factors. What ameliorates? Open air and cold environment. Okay? Fine? Okay? So mainly open air ameliorates. So this is about ALLIUM CEPA. Any quick questions or any area that you want me to repeat? Boys especially, any area that you need a revision? Yes?
Sir, if it is caused by the cold weather, then might ameliorate by the cold weather?
No, generally open air, mainly open air. See, a friend's question is absolutely right. What is she asking is, sir, if there is a causation from cold air, okay, and that's the question one of your friend also was asking. But few books give sometimes they are better by exposure to cold. Sometimes that has to be verified. But what is verified in ALLIUM CEPA is open air. So that is something you can confidently take. Okay, good. Anything else? Boys, all clear? In there? Done? Okay. How about girls this side? All fine? Okay. So with this, officially we will be finishing ALLIUM CEPA. Okay. Next class, I will see what is allotted to me. Accordingly, I will be starting with a new remedy. Before that, to your CR, I will just give you the notes also. You can, few things I would have told spontaneously. If there is anything extra, you are free to add into the note. Not necessary, you should write only my notes. So giving notes will also restrict your creativity. So don't stick only to my notes. My notes will be basic. You can refer books and you can start adding. Okay, thank you.